So in addition to the cornea and the eyelid, the white of the eye, or the sclera, is actually covered by a thin skin-type tissue, a vascular tissue called the conjunctiva. It actually wraps around the eyeball and back around the back of the lid, creating a tiny little pocket called the fornix. So therefore, if you ever lose your contact lenses in the back of the eye, it's not going to float back into your brain. It actually gets trapped in that little area. So it's not going anywhere. Now, sometimes due to prolonged exposure to ultraviolet light, that can stimulate excessive growth of the conjunctiva. That's called the pinguecula, and eventually a pterygium, where it does grow over the surface of the cornea, and that often needs surgical treatment to fix. The conjunctiva is very important in providing nutrients, lubrication, and blood supply to the ocular surface, and it's very susceptible to dryness and irritation as well. The conjunctiva becomes red and inflamed when there's an infection or exposure to allergies, for example, and that causes the blood vessels to thicken and become dilated, and that's what happens when you have pink eye.